Welcome to Unorthodoxy, the podcast where we question the rules, roles, and narratives we've been handed about healing, identity, and what it actually means to be human. I'm Chelsea, a therapist working at the intersection of evidence-based psychology and Eastern medicine with a functional approach to mental health and healing.
And I am Reverend Dr. Sheldon Steen. I'm a pastor and a Bible scholar with over 20 years experience in ministry. I have a PhD in religion, 5 kids, tattoos, and a brewery, because faith belongs in real life.
So here we hold space for nuance, the psychological, the emotional, and the spiritual, without pretending there's one-size-fits-all path to healing.
This isn't about quick fixes or perfect answers. It's about honest conversations, lived experience, and making room for complexity.
If you've ever felt like you didn't quite fit in the boxes you were given, you're in the right spot.
So let's get into it.
Yeah,
Today we've got a special guest.
Yes, we have a guest. Dr. Mary Nockhamson, chiropractor, holistic educator, and author of the Dr. Knock series. She blends physical alignment with the power of imagination to help both kids and adults find their inner strength. Dr. Mary, welcome to the show.
Thank you so much. I'm so happy to be here. And I love everything that you said, like the mental health aspect, the spiritual aspect. And I think it's so awesome. There's not a lot of, at least I don't hear about it with, priests and rabbis, like kind of having a life outside of the church or temple or mosque, right? But you're just doing it all. And so I think that's really awesome.
Yeah. Some might say I've got too much of a life outside of that, but it's great. We have a blast nonetheless.
And then I love that being here too, because I love Chelsea. I love the way she practices. Like actually going into mental health, I was a little bit but then I met Chelsea and she practices what she preaches, and she really kind of like she's not going to recommend to someone else to do something she hasn't done already. And I think that's such a big bold move, because there's a lot of people out there who are like, I'm not going to refer if I can't get you better. No one can. And that's really not fair. So I love the way she practices. She incorporates everything into her modalities of her sessions.
Right.
I absolutely love that. I know we've kind of said this word craniosacral therapy. And so before we dive in, Dr. Mary, for someone who's never heard of craniosacral therapy, how would you explain it to them in simple terms? Like Sheldon, he's never heard of it. How do we?
No clue what we're talking about here. I can't wait to find out.
Simply put, it's actually a massage technique, but I thought about it when you asked me the question. The thing is with craniosacral, you have mental health counselors in the class, you have moms in the class, you've got occupational therapists, you have speech therapists, you have people other than massage therapists taking these craniosacral courses to benefit their families. And so I'm not even going to talk about it from a massage technique. I'm going to talk about it's a hands-on, soft pressure modality. And one of the biggest keys is that when you're contacting the body with less than 5 grams of pressure, you're actually contacting the emotional system and you're treating the emotional system. I don't like to pigeonhole craniosacral to pain, because it's so much more than that. People come to me with pain, and they come to me, they stick with me because they're like, I want the other stuff, the spiritual, emotional stuff. So craniosacral, cranium and the sacrum, and there's something called the dural tube, which encapsulates the entire nervous system. And that is all held within what's known as the craniosacral system, which is the dural tube and the cranial membrane system around the head. And so it's all related. And then within that system, you have creation of cerebral spinal fluid, and then it stops. And you wind up having this expansion of your head, of these membranes, and then a short shrinkage. So you're wind up having this nice little breathing mechanism within this craniosacral system, which is flushing waste out. It's bringing nutrients too. And so we're feeling for that rhythm. And when we feel, let's say, something abnormal with the rhythm, that's when we start to dive in, ask our questions, and really feel what is happening at that core, nervous system level. Super relaxing. And also such a key too when it comes to relaxation. When I was first going to school, I'm like, ooh, relaxation, foo-foo. And I'm like, no, it's not foo-foo. It's really, really deep healing. Because when your body is in a parasympathetic mode, your body is resting, it's digesting, and it's immune system boosting. So when you put on that parasympathetic nervous system you're having a whole beautiful world of healing, restoration. And it's just an amazing therapy to be able to put someone into that position of being completely relaxed in this society. And so it's so wonderful to be able to just see people take that breath of, and just feeling that
Hmm.
support and safety.
Cool.
In a
So,
nutshell.
like, how did you get into it, and like, what convinced you that this was like the path for you, but also like that it was just effective and worthwhile in general?
Right. So I actually come from a medical family. My dad owns a primary care practice, and then my mom took over urgent care practice. And I work out of this Western medicine field. I've always been going down the Western medicine world. I was like in college for pre med, and I've always tried to go down the medicine route. And on my SATs, which are now on a totally different grading scale, I was one
Mhm.
point short 3 times on the SATs. So, I was like,
My
"I still
gosh.
wanna be a doctor, I still wanna be a doctor," and so my mom said, "Why not try dental school?" Whatever, she said, "Hours were better." Sister's a dentist, she disagrees, like, and so, like,
Like,
okay,
just
so I
go
went
be a
down the
dentist. Those people are stupid.
yeah. And then I went down the dental road and again, short by 1 or 2 points. I'm like, "Okay,
Mm,
I guess, like, it's not I'm getting older." And then I was like, "Oh, maybe I'll try teaching." And then God gave me the worst not the worst, it was just like it was a very, complex class where there were students in the class taking, like, math for the first time, the second time, and the third time. The same exact math. So I'm teaching people who've learned this math before, people who are I'm like, "This is, like, insane." And so was kind of my indication, well, maybe I'm not supposed to go down the teaching road or the Western medicine road. And then I was brought to esthetician school, which I was like, again, foo foo pretty, and which what then I saw was health of the skin. I'm like, oh, okay, I could do this. It's health of the skin. It's health. And then whenever you got an esthetician license, you got the dual for the massage. And I'm like, oh yay, foo foo for the muscles. But I'm like, no, this guy came in and she's like, wow, like I can actually run longer. I keep getting like my calves locked up when I run. And I'm like, wow, I'm actually helping this person
mm,
function better. And so I'm like, I'm where I'm supposed to be. And then just everything was so easy. Like it was a lot of work, but it was so easy. Like I was where I was meant to be. And
yeah,
so like that's why I say like I was literally pushed by God down this road because every time I tried to do a different career experience, it just would not work out. And when
yeah,
I went
yeah.
down
That's
this
really
road,
cool.
everything was just so easy. It came natural. I grew my practice based literally word of mouth. I was talking to my marketing person. I'm like, like this is the first time in my life I've ever had to market because for the first, I am literally by word of mouth. Like that's people are brought to me because my hands, they just know what to do. So that's what brought
Very
me
cool.
here. And
And
then,
they really do, and I tell everybody that I refer they're like, "Well, what do
yeah,
I tell her?" I'm like, "Honestly, she's gonna put her hands on you and know exactly what you need. She has this gift. All she has to do is just touch you, and she's like, I got you, girl."
yeah. Yeah, and the
That's
crazy thing is
amazing.
is too, is like when people are like, "What's going on?" I'm like, I'm not gonna try to figure it out. This is you. You got this. I'm here to support you." And the thing is, half the time I really don't know what's going on. My hands know where to go. I'm providing a neutral space for this person. I'm not trying to fix them. I'm not trying to actually even heal them. I'm trying to let them do what they need to do so they can have a healthier life in general and just be like completely empowering. A lot of people don't take any responsibility for their healing. And there's like, you did it, you healed me. I'm like, absolutely not. I did not heal you. God and you healed you. Take credit. You did this is all on your own. And I feel like that's an important message to tell everybody is that take responsibility and take pride in your healing process. Like you did this. I didn't do anything. I just poked a couple muscles and let you do what you were wanting to do probably for the longest time, like stick up for yourself
Yeah,
and go
yeah.
back to events where they were maybe bullied and then take themselves out of that bully moment. And it's like magical watching pain disappear, like on people who've
Mm,
been struggling for years and years and years with hip pain or arm pain, just to realize it was coming from a death of a relative or it was coming from like even a rape that they thought they had already resolved. And they're like, I thought I already spoke through this. And you're like, yeah, but you did it on a mental level. You didn't do it
right,
from a
right.
somato emotional level. And that's
Yeah.
where the three of us really like we're just a powerhouse because we're bringing all these elements, the body, the mind, the spirit,
Hmm.
and that's everything.
I giggle
Yeah,
So
because
yeah.
we just filmed our previous episode, I think it was 4
mhm,
or something like that, and we just talked about the mind, body, and the spirit, like this trifecta,
Hmm.
and that seems to be kind of our theme in our unorthodoxy episodes, like each and every one of them.
Yeah.
Mhm.
So that's why I giggled when you said that.
Because it's so true. And people like my fellow chiropractors who are missing out on that spiritual emotional component, they need to include that in their office. I mean, one of my visions is to have in every single chiropractic office a craniosacral therapist, a mental health counselor, a hypnotherapist, because it's part of our paradigm. Like subluxations and disease, they arise due to thoughts, traumas, and toxins. So most chiropractors, they're dealing with the trauma, the physical traumas, the car accidents, the trip and falls, the stress related
Hmm.
stuff. Sometimes if it's caused by stress, then the stress needs to be dealt with first before the physical injury that almost is related to that stress. Mhm. And they're really missing there. And then a lot of chiropractors, they also do the toxins. They offer like detoxes and nutrition, but like not many of these chiropractors and physical on the in the Western medicine side are touching the spirit, the mind, the emotions.
Yeah.
And it's a humongous piece. Like it's probably like I used to think that shockwave and warm laser gave me 100%, but no, it was the spiritual emotional that got me to 100% with my patient.
Mm. So can you kind of walk me through, like, what does it look like someone comes to see you for the first time?
Mhm.
What does cranial sacral theory like? What do you do?
Okay,
How does that work?
so I work in an urgent care. People are coming to me first with pain. And then while we're there, I just start asking questions like, tell me about your life. And that's where it starts. Where were you born? I have a lot of actually Jamaican people who come in and they travel from Jamaica to see me too, which is kind of neat.
That's
But
awesome.
they come in and they're like, because a lot of like Jamaicans immigrated here and their story is very kind of like the same, but interesting. Like the parent comes over here, they organize everything, and then they bring the kids over. And so that becomes a whole experience. And then so then what's the next question? What did you leave behind? Did you come over here because there was some sort of socioeconomic thing happening? There was a lot of maybe I want to say like negative, like stuff like that happening. Like, what made you move to America? Was it simply the opportunity, or was it you were trying to get away from something? And then that might spark almost like there's something awkward that's happening. That's what it feels like that
Yeah.
awkward
Yeah.
silence while there's something happening. Tell me more about that. And so then they'll go into it. They'll go when I was 8 years old. I had a whole like I was friends with all these kids. I had to leave. I left that whole life behind me. I had one person also visit with the emotional side of things. You could actually like it stimulates the senses. So he's like, I smell sugar cane.
Mm,
Very interesting. Tell me more about that. Well, yeah, there's a lot of sugar cane, I guess, in Jamaica,
that's
and so
cool.
it brought
Yeah.
him
Yeah.
back
Yeah.
to that nice childhood memory of smelling the sugar cane and what that meant to him with his mom.
Yeah.
And then having that conversation with his mom and imagination, spiritual realm. Like, what would you have liked your mom to do differently? I would have liked her to tell me what was going on, not just go over here and just do everything. Be like, listen, I'm going over there because I have to do, I'm doing this for our family to have a better life. I'm like, okay, do that right now. And so he did it right then. His mom explained it to him. And then it was like I never see these people anymore. It's just like they wind
Yeah.
up getting
Yeah.
better. And that was the source. And so like that's kind of how it works. So if someone dropped out on my table, I start doing kind of aggressive stuff. I do cupping, I do Graston, I do gua sha. I mean, I'm a deep massage therapist by nature. So for me to go on the opposite end of it and go super, super soft and ask a bunch of
Yeah. Yeah.
questions when everyone's like the again the mindset during massage is just to be completely relaxed and shut up.
Right.
You're like, no, we're gonna ask a couple questions in this session. And so it really is just amazing work what comes out because we store these memories in our tissues. I had a person or before I even knew what craniosacral kind of was, I put my hand on this person's like throat and and she was like wanting to cry. I'm like, it's okay. Tell me what's going on here. And we never really got to the end of the story, but there was obviously, to me, there was an emotional thing that happened there, whether it was a strangulation, whether maybe it was just like difficulty breathing at some point in her life, maybe even in utero. Like people are like, why do I have this? I'm like, I don't know. You tell me. You had a 30-year life full of adventure. It's just like it could. And I'm like, tell me about your birth. They're like, really? It could go back that far? Absolutely, it could go back that far.
Yeah.
Let's talk about it. And people go back in the womb. I've had this one, like it was a mom and a child, and like I was treating the child, and mom kind of just put her hand on her son. And like if they went back, and I'm like, what do you hear? I hear my mom's heart beating. I'm
Whoa.
like, wow, how does
That's
that
wild.
feel? Yeah,
Yeah.
how does it feel to like kind of feel your mom's heartbeat and hear your mom's heartbeat? And it was just like interesting with this woman is she didn't know she was pregnant. She wasn't supposed to get pregnant based on what doctors were telling her. She was like, she missed out on like 6 months of her pregnancy of those experiences of like whatever growth is
Mm-hmm.
happening and those little like things that, like it's like someone like me is just like, oh, kind of wish I could have that. But like it's that, those little things that she's like, wow, I actually felt pregnant. During that
Yeah.
session, she goes, I felt like I was pregnant. So to be able to go back and appreciate the pregnancy in that way was healing for her.
Mm-hmm. That's
So
really
yes,
cool.
magic. Yeah, really, really cool. Awesome. I ask people when they come into if they are, because I have a lot of Chabad people, and I'll say like when you're doing the Shema and you're closing your eyes, like, do you see anything? Like, what are you saying? It's just to see because if they're seeing some sort of color or they're getting sort of like to help them fine tune that, because that's another moment where people are sinking into like their subconscious mind is during that moment of like sometimes prayer. So have them.
So I know you're a holistic educator. You're also this author. So you've been talking a lot about craniosacral, like with adults. Do you mind sharing a little bit about a craniosacral story, this book that you have for children and like craniosacral and how it fits into your child patient?
So what I noticed with and this is with everything, whether you're going to take them for even like a surgery, if you're taking your child for a surgery, should still be kind of explained to them, even if you don't think that it should be explained to them, because they do kind of understand. And the example I give for that is like, let's say you're like the baby thinks they're going to a park and they're going to get their like lip tie snipped. I'm like, what does that do for the baby? The baby's like almost maybe a little lack of trust, like, oh, I thought mom was taking me to this fun thing and now I'm getting my tongue snipped. And I'm not saying anything bad about it. I'm just saying, just tell the child this is what's happening. Mommy wants to try to do the best for you, and so this is what we're gonna do so that you can have a better life or whatever it is. However they choose to explain to them, because the thing is, the babies do understand and the babies do know. They're wicked intelligent. What this book does, which is so funny because I had all of them here with me, and now like then my baby was a little bit like, so I'm like, okay, just go in the room and talk. Yeah, that's literally what happened. So she's out there with my brother doing something. But like the beauty of explaining what's going to happen is not only like will mom understand, but baby will understand a little bit better and actually like it'll the expect like there will be better healing because they're already kind of knowing what to expect. So the beauty of all my stories is that like a craniosacral story, a chiropractic story, is that we're kind of telling our child what's about to happen. You're going to go in, you're going to sit on a table. The doctor's going to put her hands and feel the muscles of your neck. It's going to feel kind of good. And so it's like, I've had parents read my story, understand more what craniosacral was about, like not even for their kid, but they were just like, now I understand what you're
Mm-hmm.
doing when you're
Mm-hmm.
putting your hands on my kid. And that's a big thing because parents want to know what's going on. And when they don't know what's going on, it just looks like we're loving on your kid. Like we're holding them, we're talking to them, we're telling them how great they are. Because affirmations are huge. Like that's what they should live by. They're like affirmations, feelings, beings. So you kind of want to tell, oh, you're so smart, you got this. You're so sick, and like, and that's the thing with like when parents take their kid to the doctor too much. It's like now put your body in the body of that kid. Always go to the doctor. Always something wrong with him. That's the affirmation. There's something wrong with me. I'm not enough. Why am I here? All that cascade of bad affirmation. Then where your mind goes, your body becomes. So now all of a sudden their little bodies may be getting sicker because they got the mentality of something's wrong with me. And so affirmations are huge. In my books, I talk about the inner physician, which is your almost the personified version of an innate intelligence, which is your body has the ability to heal itself. And so we're able to talk to these entities like our nervous system, our heart, and figure out what's going on that deep level. So I don't know if I answered the question or if I did, but like parents and children, when they read the book, they do understand more about craniosacral, and it becomes more healing because they know. I had a child who like the first visit was like a little bit chaotic. But then after that, the parent read she got next time she got on my table, she was like she just did it. And it was really like from session one to session two, a completely different, like everything about the session.
Yeah, that's good. That's good
Yeah.
that it helps, the family unit kind of progress forward and move forward. And it's funny because, as a parenting therapist, because I work with a lot of couples on parenting, I do love that the way you're describing in and out of these books to essentially like talk to your kids no matter how young they are. Like, kind of like I call it the sportscaster method. So you're like
Hmm.
sportscasting. We're gonna go into the kitchen and make a smoothie. We're gonna go to the doctor and cut your lip tie. Like we're gonna like it's just sportscasting. Like, oh, I noticed you knocked
Hmm.
over your sister's blocks. Like and there are so many benefits to sportscasting. And so I love that there's this like overlap between the parenting counseling and coaching and the craniosacral method that you're talking about. I think that's beautiful.
Yeah, it's also, and then, like, sportscasting it too could be almost like where we're talking, like, yeah, and then the kid talks back, or you become the kid's voice, and you create again that powerful conversation. But that's a beautiful thing that you do. I think like it'd be a great thing for more parents to learn.
Sure.
And it's weird. It's probably looks a little awkward in the beginning, right? Like I'm talking to this person, the person's not really talking back, right? So I'm talking to myself, kind
Yeah.
of, right? And then to be
Right.
able to kind of take yourself out of that is really the key. Like when I have people in my sessions, and I'm saying, okay, speak to your liver. Like really, that sounds ridiculous. I'm like, okay, but just for the sake of the session, just do it. And
Give
so
it a
like
shot.
it's like, yeah, give it a shot. And the thing is, it's kind of a similar thing talking. We need to all talk more. We all lose our imagination because like we're in this society where it's kind of like top down how much imagination you can use. But like as adults, if we wouldn't think talking to our heart and talking to a person who can't talk back ridiculous. It's normal in our opinion. So to normalize talking to yourself, normalize talking to babies, normalizing talking to the clouds, to the sky, for some people to God, any entity that can't be seen could still be spoken to. And it becomes powerful when you tap into that. And once you tap into it, you can't tap out.
Right.
These things
Right.
Sheldon knows
continue.
a
Right.
little something about that.
A little bit. It's
Go
true.
ahead.
Well, I mean, it sounds like what the way that y'all are describing this, I mean, it to me just kind of sounds like learning and teaching mindfulness, right? Like you're just kind of narrating like this is what's happening now and this is what's happening next. And even like the talking to the different parts of your body and things like that. I mean, it really is just kind of like grounding into your body and being aware of what's going on in there, right? So I mean, I love like it all just kind of connects together. I mean, and it again, I think just underscores conversations that we've been having, Chelsea, about the connection between spirituality and mental health. Like there's kind of no difference in some ways. Like do you attach it to a higher power or not, I suppose? Or even beyond that, like I'm obsessed with Carl Jung. And he says that one of the most important question an analyst or therapist or whomever can ask their patient and like figure out from their patient is what is their relationship to something infinite? Like, do they have a relationship to something infinite? Like, call it God, call it consciousness, call it the universe, whatever. But like having some kind of relationship to something that is beyond you that you can, exactly as you're saying, talk to, converse with. And it feels a little silly at first. Like it really does. Like I talk to clouds all the time while I'm driving, man. I'm just like, dude, you're looking great. This is amazing, because the clouds just blow me away now. I think they're super rad in a way I never did before. But yes, I mean, it's just kind of like we're just teaching mindfulness, right? Like it's beautiful.
Yeah.
Yeah, tuning into the five senses, being in the now, not
Yeah,
worrying about so much of the
exactly.
future or so much of the past, but just kind of being there in the moment and look. I love cloud gazing. It's like my favorite. Like I at one point wanted to create a facility which is a sunroof kind of thing and have kids lying on their back staring at the clouds and just coming up like that. I like how powerful that would be, kind of thing.
Yeah.
Dr.
I want
Mary
to
has
come
a
to that
cloud
place.
room.
Yeah, that sounds awesome.
Yeah, it's like a legit cloud room.
Amazing.
For those of you who are like, what's a cloud room? It's a room with clouds on like the wall. They're like cotton,
Yeah.
floofy clouds that illuminate in all fun colors.
Yeah, and I
That
have the
sounds so
kids think,
cool.
"Oh, that looks a little bit like a bird. That looks like a little bit like a heart. Oh, speak to the bird, speak to the heart, or speak to the
Yeah.
brain."
Yeah.
And then they have a conversation. I had one. He was 13 years old, Jewish boy or whatever. And I'm like, and he went down and he did his session, and I'm like, "What do you see?" He goes, "I see a bubble. And what's in that bubble? A rainbow. What does that mean to you?" It means God's promise. I'm like, "Wow, how does that feel to receive God's promise?" feel great. So it's really
That's
like
cool,
people's
and it's
imagery.
totally intuitive, right? Like, they're finding
Yeah,
that for themselves rather than being told, "This is how it should express itself to you." It's like, what do you see? What do you experience? Yeah, that's really lovely.
exactly the experience. And the thing is too, is like when people are like, because sometimes I'll get some images, but they're not my images, they're their images. But I have to be careful because they're, it doesn't matter what I'm experiencing, it matters what they're
Right.
experiencing. So like I could
For
say like,
sure.
"Oh, felt all this stuff," and they could be like, well, I didn't really feel much. Or they could be like,
Yeah, yeah, yeah.
yeah, like I felt this. I felt like I was in the clouds. I saw this. There was this one who saw like a lightning bolt. And I'm like, well, I saw a lightning bolt. Not sure if that means anything to you. It's like, well, that was what I kept seeing in my session. Like, well, that's kind of
Mm.
cool, that unity consciousness stuff.
Yeah, yeah.
But it's like it really is like people who deny the spiritual stuff are denying one of the biggest pieces of themselves that are essential for their healing and essential for their life. Because there's people who have like autoimmune things and cancers and stuff, and sometimes there is a deep hidden message in there. And like I kind of tell people too, I know it's like a little bit of a leap or whatever, but I've never met one cancer survivor that did not believe in God. Words during like
Right,
almost like he was an
right.
essential piece. And so I think if we could get there before, we pass away, like what is the message here? Oh, my family's more together now. They cared about me more than they ever did. I'm like, well, that's a big thing you just said there. Let's see if we can make your family come together without it, without this
Right.
disease or pain or dysfunction. Let's
Uh-huh.
try to reshift this, and that people have more power than they think they have when it comes to changing their epigenetics, like the way that their biology expresses themselves. But like everyone's so kind of like, I like science forward, but I think that like when people go too far in the science, they're really missing the spiritual aspect of everything. And so they're like, well, the science is, I'm like, yeah, but science can't explain this and science can't explain that. So why? So it's just like, so where's the miracle?
Yeah.
And
And
so
and it's
Mhm.
interesting that you say that because that leads me to another question, especially since you mentioned you come from like this traditional medical family, like
Mhm.
doctors all throughout. So how does this complement like traditional medical or like traditional mental health care even?
I think it would be a beautiful thing if every mental health counselor learned hypnotherapy. I think it would be gorgeous because it's something that would like because again, we're tapping into that subconscious mind. When we're mental health, we're like maybe just dealing with it at a conscious level. But I know Chelsea's got a lot of training, so she's able to get people deeper. But I think if every mental health counselor had that ability, I think that there'd be less like I like with mental health. What is my coping? Right? There's a lot of coping, but like at what point can't you cope anymore? At that moment, you probably need some God or some spiritual or something else because like how much more can a person cope? I guess is my so we gotta like kind of like unload some of this stuff so we don't have to cope as much.
Yep.
And so I feel like
Are you
not that it would
coping
be,
or are you healing? Like what's happening?
yeah, are you
Yeah,
coping or what's healing?
yeah.
That's so huge
Right.
because I feel like a lot of people are just coping and we're grateful for the coping, but it's just like it's still like over coping,
Mhm.
like you could
Mhm.
cope too much. And like so when are we gonna get to the
Yeah.
root of the problem?
Right.
And so I think that's a little bit the key with that is like it could maybe like make the mental health enhance it.
Mhm.
And now you're getting even deeper because I treated from the physical side and now like some emotions just got freed up. So now go talk to your mental health counselor a little bit about it.
Sure.
And then and so for medical, like if the heart problem is coming from an emotional type of a thing, that means if we deal with the emotional side and they go back to the doctor, they can maybe get some of their meds decreased because, their body's able to respond better to what they're using, so maybe decreasing a little bit of a dose. I wouldn't tell anyone to do that offhand. I would say go back to your medical doctor and have this conversation. I hope that a lot of medical doctors are open to having these conversations because a lot of medical doctors just shut people down like, I'm the doctor. I'm like, I don't care who you are. That's the patient. They have the right to say no. They have the right to say yes. And like, I don't push anyone to do anything. I actually don't even have people on treatment plans. People create their own treatment plans, and that's great for me
Mm.
because
Yeah.
I mean, nobody's cookie cutter. So I think a person is fully capable of coming up with their own treatment plan.
Yeah, I think you're right. And I do that also too in therapy, right? Like we we talk about what are your goals for therapy? What are your treatment plan goals, right? And
Mhm.
it's usually if people are like, I have no idea, then we do the miracle question, right? Well, if you went to sleep tonight and a miracle happened, what would tomorrow look like? Well, there's just what you want to do in therapy.
That's great. I
Right.
love that.
It's true. The key question when you ask the right. There was an iRobot. Remember, Will Smith would ask a question and he'd be like, "Sorry, you have to ask the right question." It's like that
Hmm.
too. Like you have to like what is training, like the things that me and Chelsea do is that we've been trained, and you too, like we've been trained to ask these questions, and we have a little bit of an intuition about it. So like, but you'll realize if you ask the question one way versus another way, like how do you feel looking at the clouds versus how do the clouds make you feel? One gave the clouds power over that person's
Mm,
feelings, where the other
right.
one's just like, yeah, I guess I feel pretty good looking at the clouds. So it's like being able to ask those questions like in the exact timing that they need to, and again, like just lots of practice and lots of neutrality. Like I had people on my table like kind of tell me their political orientation. And like, I know you're not gonna like, they don't even know what I believe. I'm like, listen,
Right,
your session
right.
is your session. You can say whatever you want, just don't say the obvious things where I have to like say something to someone, like there's the obvious ones like where
Right.
we have a legal obligation. But other than that, please tell me. I've had people tell me they've had some hallucinations, and I'm like, well, let's explore that a little bit because I think too, like there's a difference between like the hallucinations that are causing damage to people and like people just having really good spiritual imagination. And so like there's like a I guess a very like there's like a some sort of distinction between the two because one's a little you got to be careful a little bit with some of the stuff we do. But like let's talk to some of those hallucinations. What do they look? I had a person come in a room and they go, I see this person. He follows me around everywhere or whatever. I'm like, do you see him right now? We're in the room. He's like, yeah, he's standing right there. Ask him what he wants. If she was okay, I'll ask him what he wants. And so she asked and he went away. I'm just saying sometimes,
Yeah,
like,
Yeah.
you know
yeah,
what I mean?
right.
So yeah, interesting things happen on my table.
Yeah. So Mary, who would be like a good candidate for this kind of therapy? Who's your ideal customer, consumer?
I love working with families. I've seen relationships heal. I've seen families come back together. I really do I love empowering parents. Like that's my new gig a little bit is I want to teach parents how to write affirmations for their kids.
Mhm.
And because I really feel parents could be taking a little bit of a bigger role in that. And so that's my mission. I've been, my goal is right now to like kind of like start up workshops and literally like parents are working on behaviors all the time with their children. They're working on shoe tying, they're working on milestones, they're working on test taking, they're working. So it's like, okay, let me help you be more successful as a parent.
Wonderful.
Let me teach you how to write. So I've seen my hypnotherapy book help children who are like 6 and 13 from nighttime bedwetting. And just by saying you can do it, all your parts are connected. So there's no reason why you can't do it. You got this. You're capable. You are capable. For the affirmation, I'm not capable, or I'm injured. You're not injured. Everything's perfect in you. And so like they're like, and and these people, these kids are like they have those urinal the alarms, like the training
Hmm.
and I've listened to those go off before. My God, it sounds like you need to like leave the house because there's a fire. I'm like, what do
Right.
you if that's doing yeah, if that's doing that to me, what's it doing to
To
that
the kid,
kid?
yeah.
Yeah, yeah,
And so
totally.
now and sometimes peeing and defecating are a parasympathetic response to fear. Like let's work on this let's turn their parasympathetic on. Let's give them some safety affirmations. You are safe, you are loved, you are everything that they want to be. And after 3 readings, no more bed once in a while maybe, but like consistently not really bed.
Wonderful. So Dr. Mary, how would people find you?
Okay, I have my website is maryknockhamson.com and that has all my information on it, my email, my phone number, and if you don't have the information already, I'll go ahead so you can list it below or
Yeah, we'll
however.
link it below for sure.
Hmm.
Awesome. Yeah, and I love making everyone else. Before I was in a me mind state, like why can't I be as successful as this person? Whatever was from my mentality. And now I'm in a position where I want to bring more people to people like Chelsea, to people like Sheldon, to people like and because the work is so important. There's so many people. There really is no competition. There's enough. There's more people than there are really good therapists. But I encourage everybody to try one. If they don't like their first chiropractor or craniosacral therapist, to try another one. The different energies, different. Like for example, like I've never met a mental health counselor like Chelsea who really does again practice what
Amen.
she preaches. Yeah, and it really sets her apart, in my opinion, from other mental health counselors that I've met. I've
Your
seen
check is in the mail.
one. No, it's not. Your friendship is right here, and like I wouldn't refer to people who I would not refer myself or my family to. And so, yeah, I love working with people, whether you're a chiropractor, craniosacral therapist, mental health counselor. Let's get together. Let's try to get your patients more successful. Let's bring you back to to your spirituality, I don't want to say religion, but like your spirituality. Get these people what they're actually looking for.
Absolutely. So we'll link how to get in touch with Dr. Mary in our description. But thank you, Dr. Mary, so much for coming on today and
Thank
It
you.
was awesome.
educating us and showing so much. And thanks for our listeners for spending this time with us on Unorthodoxy.
Thank you so much for having me. It's so nice to meet you, Sheldon. I need to learn more about
Yeah,
you.
you as well. Yeah, great to meet you. Thank you. It's very
Awesome.
fun.
Have a beautiful day.
You too.